We're always moving forward.
It's such a fun thing to be part of.
I love working with the UW-Madison nursing students.
That's a life-changing experience.
We're always really in a state of growing and evolving.
When people think about nursing, they think about nurses at the bedside, and nursing is so much more than being just at the bedside. Nurses are involved in the science related to patient care, and so are able to affect at multiple levels how that patient's life can be better improved.
Early on in my undergraduate program, I had a strong interest in the scientific process. When I learned about the early entry option program, I was immediately fascinated. It allows for a level of tailoring that's not common in most PhD programs. So the option to change your course load to get into a clinical practice so soon after your bachelor's while you're also in the heat of a dissertation process is really unusual.
I decided to join the early entry option for the PhD program as soon as I started the bachelor's. I knew I wanted to pursue an advanced degree in nursing, and after learning about the program, how I would be able to gain foundational knowledge in nursing research and research a clinical problem that would help to improve patient care, that was very appealing to me. I am researching patients with traumatic brain injury and their family caregivers, looking at their experience during the hospital stay, what their needs are, so that healthcare providers can provide them with better support.
We are fortunate to work with the cream of the crop. The talent that this school attracts is incredible. The School of Nursing prides itself on a very rigorous admission process, and generally these are the finest students interested in nursing that get here.
My research stems from simulation that we do in preparation for that clinical time. So I've specifically looked at using our amazing simulation facility to do a psychosocial simulation with my students. Here at UW-Madison, we have the students for an entire semester for their very first clinical rotation, and that is great because we get to really tailor learning to what needs need to be met for each individual student.
We really value our preceptor model. Students are learning the role of a nurse in a population-focused setting instead of starting over in multiple sites. They're getting an in-depth experience where they can explore that community or public health system on multiple levels and really, again, transfer that learning experience to other settings. Preceptors really value working with our students.
The preceptor model used by UW School of Nursing is really fabulous. I've been engaged in it in a number of different levels for the past 20 years, and as an alum, I'm really proud of that. The preceptors are supported by the School of Nursing in very specific and evidence-based ways. And our preceptors benefit by feeling a real sense of connection with the university, which empowers their practice. The students often say there's such a broad array of both individual and population-based experiences that they feel they'll carry that with them into any site.
I love working with the UW-Madison nursing students because they tend to rejuvenate my practice. The students that have come to work with me have been really well prepared.
One example of students' insight is they say, I have learned that school nursing is not about putting Band-Aids on, it's not about tummy aches, but they learn about the really significant issues students have with health.
Our clinical model also enables interprofessional learning opportunities. Students frequently are participating in care rounds on the unit. They're making that phone call with the help of their preceptor or staff nurse when things are happening with patients.
I am thrilled to be here. I am a first-generation college student, and so from the moment I set foot on this campus, it's just felt like home for me. So the fact that I'm actually here now and able to teach classes for the university and mentor up-and-coming nurse scientists is beyond my wildest dream.